My name is Opokuwari Ampomah. I'm a consultant plastic surgeon and I'm the current director of the center. Well, as a surgeon, in terms of resources, we have limited resources, but we had a good training program in place, which I was privileged to undergo, and my senior colleagues were here. They also helped me during my period of training, and then I had the opportunity to also train in the UK and qualified in plastic surgery in the UK as well, and I've also been to other places like Taiwan, etc., to broaden my experience. So this unit, as I say, has got all the expertise to solve most of the problems that can confront any plastic surgeon anywhere. And we, even given the limited resources, have been able to undertake and treat very complex cases. And so I think the quality of service generally is very good, and it's respected worldwide. And I think one of the most satisfying areas of our work is cleft lip and palate surgery, because you can actually see the transformation in the lives of the patient. Because when patients are born with these congenital defects, one, it is something that's a source of disappointment and embarrassment for the patients, and some of these children, when they begin to grow up without having these problems repaired, they have a lot of psychological and emotional problems. But then when they have treatment, you can see that they get their lives back. It restores their confidence. They're able to integrate into society better, and they're able to move on with their lives and make something out of themselves. So it is a very rewarding work, and it's very nice when you happen to meet a patient in town, and they're happy to see you, and it's very nice and fulfilling practice. Looking towards the future, we want to get to a point where no child in Ghana would have to live with a cleft lip or palate defect for longer than necessary. We believe that for cleft lips, they should be repaired around when the child is about 3 months of age, and then palate usually repaired in between 6 months and 18 months of age, so that when the palate repair is done early, then the child has the potential to be able to develop normal speech and also avoid some of the other problems that are associated with this particular pathology. So in the future, we want to see the time where children with these defects will be referred to us promptly, and will also receive the appropriate treatment early enough so that they can lead a relative normal life. Cleft lip and palate is a congenital anomaly which happens everywhere in the world. It's even commoner in other parts of the world. In Asia, other places, about 1 in 500 births, whereas over here it's about 1 in 1,000, 1 in 1,200 births. So we have a slightly lower incidence. But then something that happens anywhere in the world is not because the parents are evil or they've committed any sin, or it's not a curse or anything of that sort. It's something that happens, and it can be taken care of. It's not a life-threatening condition, and when people report to hospital early enough, there's treatment available locally. We have a comprehensive team that looks at all the aspects of cleft care, and we're able to offer continual care in a comprehensive manner. And so people don't have to wait for any foreign missions, etc., to come to the country before presenting themselves for treatment.
Oh, I'm the, shall we say, the veteran of the place, the oldest. And I've been involved in the plastics in Ghana, certainly from 1993. But prior to that, I was doing something similar for 16 years. Senior registrar consultant grade. And also I had the chance of working in almost every part of Great Britain, including Ireland and also abroad in Saudi Arabia. I would say we're, I don't know whether it's courageous, but with the limited resources, we are able to adapt and deal with difficult cases with the resources that we have. And the quality, as far as I can tell, is just as good. It is important to help these people who for some reasons, or in certain societies, are not even brought out to be seen by other members of the society. And also you can improve their quality of life, so it is very important. It's not a killing disease, but certainly it can affect the quality of life if the defect isn't corrected. Well, I'm hoping that with time we'll be able to, shall we say, reproduce ourselves. In other words, produce more plastic surgeons such that at least in the district level, there may be at least a plastic surgeon to deal with some of these cases. If there are more difficult cases, of course, the old institution like ours can help the new ones outside how to cope with the problems.
I'm Albert Paintsil, consultant plastic surgeon working in this center. I've been working here since 1999, so I've seen a few years of action. And when it comes to the work in the center, I've been involved with this project with Transforming Faces Worldwide, a Canadian NGO that offers comprehensive cleft, lip and palate care to patients. With the lip defects, this is the part that everybody sees. So for the mother or parents who had gone in for the so-called normal baby, when they have this sort of problem, they are distraught, they are worried, they have social issues. And in Ghana, naming a child is a big function where everybody comes, and these children sometimes they can't do that. So when you sort out the lip aspect of the problem, these parents are forever grateful. They can now have all the social activities, take these children everywhere. With the palate, the major problem, in addition to all others, is feeding and speech. So once you fix that and you do it very well, these children can pass for normal, join their colleagues in school and all that. And that is what this program does. We've been doing for the past 7 years plus. We've operated on more than 500 children. And the most important aspect is the follow-up. And that is what is missing in all other programs, because people come, operate and disappear. But we are here, we operate on them, follow them up, so that if there are any other problems, we sort it out. In addition to that, you cannot treat a child with cleft and say you are done within a short while. Till these children grow, girls maybe around 18 years, boys around 21 years, you will have to continue following them and seeing what other problems they have. And last but not least, the program also caters for the transportation costs and sometimes feeding of these patients when they come to the clinic, the panel clinic, which is once every month. And so they are more than willing to turn up anytime you want them to come. If you have a child born with any of these defects we've talked about, cleft lip, cleft palate, any second Thursday of the month, you are welcome to bring your child to this place. And not only children, there are even some adults who have missed the chance earlier in life to have the problem sorted out. If they do turn up, they are also most welcome. We will not drive anybody away, and there's always help for such a person who needs our services. Thank you.
My name is Josephine, Mrs. Josephine Mensah. Yes, and I am a pharmacist at Korle Bu Hospital. I was born with a cleft, and I've been operated 6 times. Yeah. I started when I was 18 years, so I was a bit old. When you are born with a cleft in your palate, you tend to talk in a different way. You don't have a cleft, so you don't use it to talk. So even after the surgery, you still talk like how you were talking before the surgery. You need to be trained to learn how to use the cleft, how to use your new mouth. For instance, in my case, I had grown up for 18 years and above. I was talking in a particular way, and all of a sudden I have to learn how to talk in a different way. This is about 80% improvement in my voice. So you can imagine how I sounded earlier on. Just a few people could hear me, my family, and then a few friends. But now at least my patients can hear me. I'm able to interact with my patients on the ward, at the pharmacy, in the community. People can hear me well. It's not 100%, but there's an improvement. There's lots of improvement. I can talk more when I go out. I just want to tell everybody that when you are born with a cleft, it's not your fault. You don't have to feel miserable. Then again, when you're a parent and you have a baby with any deformity, cleft, whatever, you have to make an effort to help the child take the necessary steps so that the children can be helped. So everybody should support people with deformity. They shouldn't let them down, they shouldn't shun them, they should get close to them, encourage them because they are normal, they are part of us.